Hi, I'm Dr. Tracy Larson at Thrive with this week's Monday Motivation. The idea of restricting calories to lose weight is certainly not a new one, but the idea of restricting calories on a schedule is something that's received a lot of attention in the media recently. Intermittent fasting is an idea where we are cycling our pattern of eating between periods of fasting and periods of feeding. It is not as concerned with what we eat as opposed to when we eat it. There's not an official definition for fasting, but generally we consider it to be an intake of a maximum of 500 to 600 calories a day, a fraction of the average American 2,700 calories a day at least. Intermittent fasting programs have a wide variety. They may include something like fasting one day out of a week or 5 consecutive days out of a month, every other day, or maybe even just eating 8 hours out of a 24-hour period and fasting the remaining 16. The idea of intermittent fasting is based on 3 phases. The first phase is the feeding phase, which starts when we eat a meal and lasts for about 3 to 5 hours as we digest and absorb our food. The next phase is the post-absorptive phase, where our body is kind of in a holding pattern until we reach the fasting phase. The fasting phase starts about 9 to 12 hours after our last meal, and it's when our body changes its metabolism and becomes fat burning. We know that overweight and obesity are big medical problems in our country, and they are the cause for a lot of chronic diseases such as high blood pressure, cardiovascular disease, diabetes, and even many cancers. Most weight loss programs focus on limiting calories on a daily basis, such as 1,000 or 1,500 calories a day. Studies have shown that intermittent fasting versus daily calorie restriction have about the same success rates, with the same amount weight loss, the same amount of dropout rates, and maintenance of weight loss. What works for some people may not work for the other. Intermittent fasting can also have some other health benefits besides just weight loss. It has been shown to decrease risk factors for chronic disease, including cholesterol, blood glucose and insulin, high blood pressure, waist circumference, and body fat. It has also been shown in lab animals to improve their longevity or lifespans. In human subjects, intermittent fasting was shown to decrease the level of a hormone called insulin-like growth factor, which was shown in animals and labs to promote the aging process.